Well, here is an organism that is human. So it's a human being. It never turns into a pig or a frog or a pine tree. It's
Mhm.
one continuous existence. So we don't have a point in time where there's a non-human being and then a human being. What we have is a human being from the moment of sperm egg fusion.
Hello and welcome to Caring for Both, a curbside consult series by the American Association of Pro-Life Obstetricians and Gynecologists, or AAPLOG. On this podcast, we bring on experts to provide insights to support you as a medical professional in your life-affirming practice and career. I'm your host for today, Dr. Christina Francis, board-certified OBGYN and also CEO of AAPLOG. Today, I'm so honored to be interviewing AAPLOG's Director of Research, Dr. Donna Harrison. Dr. Harrison's a dear friend of mine and longtime leader, as I'm sure many of you know, of AAPLOG. As you might remember, she was my predecessor as CEO at AAPLOG, a position she held for 10 years, during which time she grew the organization from only about 2,000 members to roughly 7,000. Today, Dr. Harrison heads up our research efforts, including a new to come document that we're going to be talking about today. So we're recording this episode prior to the publication of our newest committee opinion as a special preview for you, our podcast listeners, but it will be available sometime in the next couple of weeks on our website, applog.org, in the resources section, and we'll put a link to that in the show notes as well. We're really excited about this new committee opinion. It is on the ethical treatment of embryos, a very hot topic, of course, in the public discourse right now that relates to both clinical practice and scientific research. So I'm really excited to be discussing this topic with Dr. Harrison today, as I know many people are really thinking maybe for the first time critically about this issue. So Dr. Harrison, thank you so much for being here today.
Christina, I'm so delighted that we have a chance to talk about this issue. You're right. It's a hot topic right now and really important for our practice as pro-life OB-GYNs.
Absolutely. Absolutely. Well, let's jump right in because I have lots of questions to ask you. So Donna, our listeners probably know that our position at AAPLOG, and actually the scientific position, is that a new human life starts at the moment of fertilization, when a sperm and an egg fuse together to become a new organism. But I want to dig into that a little further because as I think this paper lays out very well, there's a lot that goes into that. So can you just tell us at what point is a new cell formed that's distinct from the sperm or the egg? And then does that single-celled organism count as a human being?
So yeah, that's a great question, and it's important that we think really critically and carefully about this. So scientifically, from an embryologist's point of view, the question is, when does a new organism occur? When is there a new cell that's different? And if you look at the function of an egg cell is to bind with the sperm. If you look at the function of a sperm, that's to find the egg cell and to join. But once you have sperm egg membrane fusion, then the entity that's formed is not an egg and it's not a sperm. It's a completely new organism that has its own self-directed growth and continuous self-directed growth and existence until natural death.
Yeah, absolutely. Well, and that single-celled organism, when I'm using my apologetics about when life begins, we talk about at that moment you've got a whole organism that nothing else is going to be added to from that moment in time. That organism will just develop. But does that organism, the science tell us, does that organism constitute a human being, or is it something else? Because I've heard some people say that this is a potential human being or something like that. So in your review of the scientific literature, what have you found? Is that a human being? Is it a potential human being? What is it?
Well, here is an organism that is human. So it's a human being. It never turns into a pig or a frog or a pine tree. It's one continuous existence. So we don't have a point in time where there's a non-human being and then a human being. What we have is a human being from the moment of sperm egg fusion. And that's because it is one organism with one continuous trajectory toward its own growth and development. And so it's clearly human, and it's clearly a separate organism. That makes this a human being.
Absolutely. Well, and I think sometimes some of the discussion or differences in opinion about the value of human embryos maybe comes from the fact that some of these human beings don't actually live for very long. So sometimes the fusion of sperm and egg does not result in either in a living organism at that moment or a living organism that survives for very long. So could you explain this? And also then, does this, the fact that maybe they don't survive very long, in any way challenge your stance on the beginning of life?
Well, if we can take it a little bit of an analogy, if we have human beings who are 2 years old and they have cancer,
Mhm.
because they have cancer and they're not going to make it to 4, does that mean that they're not a human being? Of course not. And so here we have what is clearly human, clearly an organism with a life-limiting defect. If we look at the big picture, we all have life-limiting defects. And
Mhm.
so to arbitrarily say, well, you have to reach age 5 or you have to reach age 10 to be counted as a human being, or age 18, it's an arbitrary and a social construct, actually. But
Yeah.
the reality is, the scientific evidence is that these the sperm and egg at the time of sperm egg membrane fusion have individual parts within that organism which lead to syngamy, that is the joining of the two nuclei into one
Mhm.
human karyotype. And it has growth, even at 2 cells and 4 cells, differentiated cells that will form either the placenta or the inner cell mass, which becomes the corpus, the body of the embryo. So it's all self-directed, and it's directed from that moment. There isn't another point. There isn't a discontinuity between sperm egg membrane fusion and onward. So if we say that, here is a new embryo, here's a new human being, then just because that human being only lives a couple hours or a couple days, that doesn't mean that there wasn't a human being there. It means that we need to recognize there's life-limiting defects that can happen all the way along in any of us,
Yeah.
and that doesn't make us not human.
Absolutely. Well, and also, the fact that sometimes when you get sperm egg fusion, something might go wrong, such as in the case of
Right.
like a complete molar pregnancy or something like that. Just because something might go wrong doesn't mean that that moment isn't the moment where a new human being is created. So, I think that's important to point out as well. We don't define sort of normal function, or we don't define a species based on an abnormality that might happen. It's only an abnormality because we have a normal that's defined, and that normal that's defined, as you stated so clearly, is that human being comes into existence at that moment. And I think the other important thing to point out here is that that human being doesn't suddenly become a human being just because he or she has implanted into mom's uterine lining. He or she is a human being from that initial moment of creation. It's just that at the point of implantation, that's when we know that human being can continue then to develop normally along that developmental trajectory. So typically when we're talking about fertilization and the creation of a new human life, we're talking about that occurring in vivo or inside of a woman's reproductive system. However, of course, we now have the technology to fertilize eggs in vitro or in a lab. And according to our new committee opinion that will be coming out, 30 to 50% of the zygotes or single celled embryos created by in vitro fertilization don't actually go on to become blastocysts or multi-celled embryos, which is that next stage of development. I think we've already answered this, but I also think that we should be very clear. So just because those zygotes, those single-celled embryos, maybe won't progress spontaneously or on their own to further develop, does that mean that they're not human beings at that moment?
No, we don't have a way of telling which zygotes, which first single cell human beings. We don't have a way of telling which ones of those will go on to blastocysts. There are some pro-life OB-GYNs who would say, look, until you can tell for sure that they're going to continue, then it doesn't, you know, if we can't stop the embryo from dying, then
Mhm.
it isn't something that we have moral culpability for. And so we will take and treat those embryos that we could stop from dying, the blastocysts, the ones we can identify, those are the ones that are easier to say, hey, here's an embryo. But I think the important thing that AAPLOG has been very clear about is that we consider human life to start at the beginning, at sperm egg membrane fusion, where organismal life starts. And we will advocate for the best circumstances for those embryos to continue. Now, understanding, as you said, that maybe up to half of them won't continue to blastocyst, but that doesn't lessen their dignity as human beings.
Absolutely. Well, and I think, pulling in another analogy, as you said, all of us have some sort of life limiting defect or, something that's going to end our lives at some point. But of course, I have no way of telling by looking at you. You have no way of telling by looking at me how much longer I have to be living.
Right.
But even if we knew that a year from now there was something that was going to end my life, it still wouldn't give you the right to intentionally end my life right now. And I think we're talking about a very similar thing in that we support producing circumstances that would give all of those human beings the best chance at life possible,
Right.
understanding that, we are not God. We're not going to be able to ensure that none of them die, certainly on their own, but setting them up for the best possible chance at survival, just like we would want for any other human being. So
yeah, and I think that's the point. The point
yeah,
is we're recognizing that what we do have control over, we want to optimize for the best outcome for that human being and the mom.
yeah, absolutely. So we talked a lot about sperm egg fusion and that's the point at which a human being is created. But are there other means by which embryos can be formed? And if so, how does that work? Now we're going to get into the more nitty gritty sort
Great.
of research area of our paper.
So this is the very sobering and disturbing thing. There are ways to form human embryos other than sperm egg fusion. So you can take stem cells, you can take other precursors that are not sperm or egg, and you can, by changing some of the regulatory proteins, you can cause that embryo to now form organs, and in some cases, at least in animal models, take them through organogenesis, take them up through birth. So there's a proposal now to allow for experimentation on human embryos beyond 14 days. Okay, there's something in the past called the 14-day rule, where scientists have said, well, it's okay to experiment on human embryos, but not past 14 days because why? Because they couldn't get an experiment past 14 days. Well, now they can. And so this is very sobering. We talk about this in our paper. The proposal that's before the UK Parliament right now talks about the creation of these human embryos, which can recapitulate organogenesis, which that means these embryos can make organs and go through the developmental process to create these human beings for the purposes of exposing them to toxic drugs and seeing what happens to them, for the purpose of purposefully deforming them and seeing what happens to them, and for the purpose of pharmacological drug testing. Now, this is horrific. This is the creation en masse of human beings for the purposes of objectifying them into property that we simply use for scientific knowledge. This is just barbaric.
Absolutely. Well, and I think it's important for us to point out because I don't know, as I listened to you, Donna, and the first time I heard you discussing this, I thought it sounds like we're in the midst of some sci-fi movie or something, and surely this can't be real. But I think it's important to point out that these human beings, even though they might have been created in a slightly different way than what we consider the traditional way, they are in fact still human beings. They have human DNA. They have self-directed development once they have been created. They're a living organism. They meet all the criteria for a living human being. So even though their creation was slightly different than what we consider sort of the quote unquote normal way that a human being comes into existence, they're still human beings. And as you said, these are human beings that are being created without their consent for the sole purpose of experimentation. I mean, this harkens back to some of the darkest times in our history, in the history of medicine and science, when, swaths of human beings are being experimented on without their consent. and being created for that sole purpose. And so, so this is really a horrific, I think, abuse of human rights that this is being considered, and certainly those of us within the medical and scientific fields need to be aware that this is going on, so that we can oppose this kind of research. Because again, we believe that all humans are equal, regardless of the circumstances of their creation, and should be treated with respect, and should not be experimented on without their own consent. Which I think, if you ask most people on the street whether or not you should be able to experiment on human beings without their giving their consent, I think most people would say no. And so that certainly needs to apply in this case as well.
Well, and there's something important in what you're saying too.
Yeah.
There are populations that can't give consent. Children,
Sure.
people who have some cognitive limitations that they can't understand the consent form. And in those cases, we always have said there needs to be a proxy caregiver, someone who cares about the life of this individual. And this is something that it's not just an American thing. This was negotiated human rights documents that we've had since some of the darkest times in medical history.
Yeah.
And as nations, we have said that the care of human subjects is primary. It's more important than the scientific knowledge gained, that we can't do intentional harm to people. And in all of these things, you accurately pointed out, in these experiments that are proposed, the human beings that are being experimented on don't receive any benefit at all.
Right.
Normally in research, there's some benefit. If you go into a clinical trial, you may get better with this drug.
Right.
These are purely objectifying, taking human beings and treating them like non-humans. And that's why we have to speak out about this. This is really something that brutalizes us as a people. That this takes us back to when we didn't care so much about human beings, and we have to be speaking out for it.
Yeah, absolutely. Well, and I think that this is detailed in the paper as well, but there are basic sort of ethical guidelines that guide clinical research in human beings that actually say that in populations, these really vulnerable populations, like children, like people with cognitive disabilities, that we actually should take more care when we're doing research in those populations, and ensure that the benefit far outweighs the risk to them of being a part of this research. And so, that same principle really should be applied in this situation, because of course these children, these embryonic children, don't even have the option of getting away from the research or anything like that. I mean, they really are sort of the most vulnerable. And so extreme care should be taken, again, like you said, to ensure that they would receive benefit, and there really is no benefit to them. They will be destroyed in the process of the research that is being done on them. And so, I think it's just important to remember when we're talking about these kinds of things that extra care actually should be applied, even more so than we apply to research on adults and things like that. And I'm pretty sure we've had Dr. David Prentice on the podcast in the past, talking about the outcomes of research done on embryonic stem cells versus adult stem cells or umbilical cord stem cells, which of course have much more promise than any research that's been done with human embryos. So, just real. Sorry, one more question about the human embryonic models. Do you think, what are your thoughts on the creation of these? Are they ethical in any way, the creation of these ethical, or, are there any other ethical considerations? So let's say we say, okay, well, these can be created, but they cannot be destroyed through research. Would it still be ethical to create these human embryo models, or are there other potential pitfalls that we should be thinking about?
Well, there's no reason to create human beings simply for the purpose of experimenting on them. There is no scientific knowledge in the world that's worth torturing and killing human beings. And so there isn't really an ethical reason to create an independent human being. And again, remember the psychological part of this too. These are human beings who would then have no parents, no other relationship, no one to speak up for them, no one to defend them. This is just, it's wrong-headed and wrong on so many levels, the psychological, the physical, the scientific, that I can't think of a reason why this should be permitted. There should be a worldwide moratorium on the
Mhm.
creation of human beings
Absolutely.
for
Absolutely.
experimentation.
For experimentation. Yeah, absolutely. Well, and to me, it reminds me of the Tuskegee experiment, which many of our listeners have probably heard of. But if you haven't, it was an experiment that was done on hundreds of African American men who had syphilis. And during the course of following them to see how the disease of syphilis would progress, a good and effective treatment was actually discovered. And most of us in medicine know that penicillin actually is a great treatment for syphilis. But that treatment was knowingly withheld from this group of men without telling them, without informing them that this treatment was available. It was withheld because the researchers wanted to see what the natural progression of the disease would be without these men receiving treatment. Was scientific knowledge and medical knowledge gained from that experiment? I mean, definitely it was. We know what the progression of syphilis is if it's not treated. But did that medical knowledge justify the harm that was done to these men? Absolutely not. And I think that that's a good example of showing it doesn't, as you said, it doesn't matter what knowledge we get out of this kind of experimentation. It is not ethical. It is not justifiable if we are intentionally harming human beings and in any way. And so I think that that's really important to remember, because oftentimes I've heard people defend this kind of research by saying, yeah, but imagine the knowledge that we'll gain, or the future diseases that could be treated, things like that. What it tells me is that it is upon us as a medical and a scientific community to come up with other ways to gain that knowledge and not intentionally harm human beings.
Yes, exactly, Christina. You hit the nail on the head. It's the issue of knowingly and intentionally harming a human being for nothing else than your own knowledge.
Yeah,
That's just wrong.
yeah, absolutely. Well, we're running out of time here, so I think we'll probably do another episode where we talk specifically about ethical considerations for treatment of human embryos in assisted reproductive technologies, which is also a very hot button issue right now. But just as we wrap up, Donna, what are some takeaways for those of us in the trenches, for pro-life practitioners who might be interacting with patients, or might be tempted to think that we should consider embryonic research for the benefit that might be gained? What were some takeaways that you could recommend to, like I said, physicians in the trenches, other practitioners who are wanting to serve their patients and help their patients, but with considering these things that we've been talking about?
I think one very practical application is if we have a voice, if we have a chance, we need to say that this creation of human embryonic models is horrific and we won't do it. So that's really important. But
Yeah.
also as OB-GYNs, we have the possibility in prenatal counseling and even in, preconception counseling to
Mm-hmm.
talk to our patients about the value of their own body as a good place for life to start. And
Mm-hmm.
also when women miscarry, oftentimes they're basically it the medical community can sometimes act like nothing happened. I just passed a little tissue.
Right.
Rather than acknowledging the fact that this woman has lost someone. And
Mm-hmm.
that's very healing to acknowledge, to say, hey, honey, I'm really sorry that you lost your child. And what we know is of all the things that have to happen when the sperm and egg come together, some didn't happen. So this baby had a short life, but that doesn't mean that you don't grieve. It means that you do grieve this human being who had a very short life within your body. And
Yeah.
it's just a way of humanizing and helping the mom to understand her own grief,
Yeah.
and also helping them to understand how important it is to care for their body preconception. So I think it has a lot of practical applications for us.
Absolutely. Absolutely. In my own experience as a physician, I've never regretted uh, talking honestly and openly with my patient about the humanity of their preborn child, whether that child was, as you said, just a few weeks old or farther along, and whether that child was born alive or not. So I really think it's important that we help families to understand that was their child, regardless of the length of that child's life. So thank you so much. And I think you're right. That's a great way of sort of pulling pulling things out of the sort of research hemisphere that we were in a little bit and really making a practical application. So, and as I said, we'll do another episode with Dr. Harrison, I think, about the implications of this consideration of when human life begins for assisted reproductive technologies too, and how do we apply that in our own practices, and how do we talk to patients about that. So Donna, thank you so much for joining me today. It was so fun to have you on and get to talk to you in this venue. And thank you to our listeners for joining us today. If you like this episode, please be sure to give us a like and a subscribe on YouTube, or if you're listening on a podcast app, give us a 5-star review. Also, please help us continue to clarify and provide accurate information in the midst of so much confusion that's out there right now. We can only do this through our members who are faithful in paying their dues and through your support. So we encourage you, if you would like to continue to support what we're doing, please go to our website and click on the donate button. Thank you so much for joining us, and we'll see you on our next episode.